Okay, good evening, good morning, good afternoon, wherever it is you're on the face of the earth. Thank you for joining us. This is Living Health TV. Let me just put this on mute so that it doesn't distract us. All right. Thank you for joining us. This is Living Health TV. I am Dr. Benga Adebayo. It's a pleasure to come your way wherever it is you're watching us from. Last week, we had internet problems. I hope today we are not going to have internet issues so that we can delve into this matter very well on how to raise your child. What are the things, Child Health 101, what are the things that I think are important that we should watch out for as we raise our children? The children are a blessing, and it takes wisdom, it takes insight, it takes proper knowledge to raise and groom those children so that we don't get bereaved of our children, God forbid, or we have children that do not reach their full potential due to mistakes that we make about their health. Okay, so if you're joining us for the very first time, my name is Benga Adebayo. I'm a public health physician, I'm a health communication specialist, and I am also known by some people as area doctor. We speak, now, as we do for area, discuss area matter. So, but today we want to keep it, not just speak English, maybe at the end we do a little bit of area level now. So we want to talk about raising your children, common mistakes, common myths that people have about child health, and then we discuss them in the light of the science. I just left uh, another live stream that I just did somewhere. I spoke somewhere. We're talking about people talk about all kinds of stuff about vaccination and how it's important for health of children. A lot of myths about vaccination, about what it does. It causes this, it causes no. Vaccination save lives. Save lives. So if you are joining us, wherever it is you're joining us from, please remember to click the like button. If you have not subscribed to Living Health TV before now, please don't dull yourself. Make it go like, make you subscribe to our channel and make you like this video. Share this video with your friends and your loved ones. Okay, so let's get right into it. Child health, Child Health 101. What are the things that you need to know that will help your children to grow? We started last week and we started to talk about a few things. I'll just go over them quickly and see if we can talk about new things today. So, first and foremost is the health of your child starts in the womb. The health of a child starts in the womb. And this is even more important for female children. Yeah, but so I remember somebody said to me, why is it only female? Everybody, they have World Women's Day, they have World Mother, two Mothers Day. They have, women are powerful, women are special. The health, the fertility, the health and fertility of a female child is established in utero, right? The number of eggs she's going to have all her life is established while she's in the womb. So it's important for all our women folk to be healthy while they are pregnant, to to raise, to be healthy in their so antenatal care. Make sure that you use your meds so that your child can grow optimally, so that you can prevent all these deficiencies, so that you don't have anemia, you are not anemic by the time you are having your baby, you bleed, and then all kinds of complications set in. So use your medicines, use your antenatal drugs, your supplements, use them judiciously. Go for your antenatal care, right? There's really nothing like I'm eating for two in pregnancy. Eat well. You know, some people just say I'm eating for two, or if you're expecting twins, I'm eating for three. And so they just eat all kinds. They just consume. No. You are eating for a healthy self, and your baby will take what your baby needs. You just eat healthy. Make sure you eat uh, healthy. So we started last week. So your baby's health, your baby is born. So people do all kinds of things. I saw one video, Kai, when the woman was beating the baby and started squeezing, bending, contorting the baby into all kinds of shapes. Oh my, oh my. No, that's not necessary. That's not needful. It is not needful. Thank you. Thank you. Sorry you've been waiting. Thank you for joining us. Thank you. So remember to share the video. Sorry we came in late. I was on another session, training somewhere, and I had to wrap up quickly to come and join us. So thank you for waiting. Next week we'll be back to 3 p.m. Today we had to shift because of this. I couldn't say no to the person. I couldn't say no to him. Good afternoon, Timmy Talker. Thank you. So the person was squeezing the baby, contorting the baby, and saying you are batting the baby to keep the baby flexible. No, that is that's risky, you know. When, when I was watching that video with somebody, the person started screaming, "Wow, this baby, did the baby live? The baby died, the baby live." So we don't want that. We don't want to do all those contortioning and all those things. No, it's risky. You can kill that baby. You can harm that baby. Bet your baby normally. If you know, some people do exfoliating and all kinds of things. If those things are not harmful, I don't know. But bet your baby normally. Care for your baby normally. We talk about cord care. That's very important for a newborn baby. You don't need to put it. You don't need to dabble and do all kinds of. People do crazy things. Like I said last week, like I said to people, it's a miracle that someone survived. It's a miracle that you live to old, that you are what you are, because all the things that you are subjected to. Wow, crazy stuff. So all you need for the care of the cord of a baby is to clean it regularly with spirit. What do you want to prevent? Infection. That's all. So clean it regularly with spirit. Clean it with spirit. Clean it with spirit so that it gets dry and it drops off. And then that stuff that is still there. So clean that stuff until it is properly covered. And then you are home and dry. And then after then, we said what? Breastfeeding. Breastfeeding is gold standard. Gold standard. Breastfeeding will not spoil your breast. Uh-uh. To not make your breast sag and destroy. You are destroying my figure. You are the one that destroy my figure. I know a lot of women say that. So you destroy my figure. You are the one that destroy my figure. Breastfeed your child. Let that child grow 6 months. That the child's going to be brilliant. Brain develop well by the grace of God. Yeah, because your breast milk is the most nutritious thing. There's a culture that I spoke about last week. I just want to reiterate it again. That first breast milk that comes out, the colostrum, the clear fluid that comes out, some people culturally say it is dirty and then they squeeze it and they throw it away. We don't do that, right? That is nutrition for the baby. It's important. It has a lot of immunizing factors that baby needs. So you give it to your baby. And we also know some culture before now, when the woman just born the baby, they don't give the baby, they go and first bathe the baby before I go and clean the baby. As soon as that baby comes out, let the mother carry that child. Let them bond together. Don't keep them apart for long. Don't go and bathe for a baby for 3 hours before that baby is hungry. Getting through the breast canal. Now stressful. Life now stress and stress now life. So we want that baby to be united to the mother as soon as possible, as quickly as possible. You want the baby and the mother to be together. So we don't separate them. You don't keep them, just go and keep the baby. Then 4 hours later, the mother say, I'm tired. I'm tired. Oh, no, 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 no. So unite mother and baby, breast milk. Let's leave that. There's one culture that we have in the southwestern part of the world. I know it's in the southwestern part of the world, and that's backing our babies. That's a fantastic culture. Unfortunately, and funny enough, the good culture that we are swapping it for the baby carriers that your baby's leg is just dangling. There's a condition that we don't find often in the southwestern part of the where we back babies, and that's the congenital dislocation of the hip joint. There's some babies that are born and their hip joints are not in place, so they will need to. Do you know what? When you back your baby and you put your baby on your back and you put your pal, tie your pal, and carry your baby at the back, that position is what is used to splint the baby in split. That's the medical position for curing that condition. So backing your baby, supporting the neck properly, And putting the baby on the back actually is treatment. It's treatment for congenital dislocation of the hip joint. So that's a good culture that we should continue. So if you are here, you are not backing your baby, you are not doing carrier, and the leg is dangling, and you are feeling cool. Okay, so maybe you see your baby's face, it's nice. But that backing of our babies that we do culturally in this southwestern part of Nigeria is beneficial, medically beneficial. Uh, and I know babies in those days when they back baby, the baby sleep well, they sleep properly. So that's a good culture that we've seen that medically is beneficial because that position that you put your baby, the leg is put, once you back the baby properly, you know, some people back baby and the head is, no, we don't want that. So let people help you position the baby properly, back your baby. It's a solution for congenital dislocation of the hip joint. That's how we solve it. That's what the splint that is used is essentially put the baby in a position and say the baby has been backed, right? So backing your baby, I think it's a good culture that we should not throw away. Don't throw away backing. So that's a good culture. That's a good practice that we should continue. So besides the baby developing, that's there to discover there are milestones that your baby should have. At a certain age, your baby should, you give your baby something, you take it from one hand and put it on the other hand. It's one of the things we use. If you bring a baby to me, I don't know the age of the baby. I'll just try to get the baby to do some things so that I will have an idea. Okay, when this baby can do this, this is a milestone at the baby. There's an age the baby should be able to lift up his head. The head should not be dropping. You shouldn't have a 6-month-old baby and the baby's head is just falling anywhere you put it. That's a danger sign. So you need to know these milestones of what should occur. Baby should walk by maximum 18 months. Baby should be walking. By some people 12 months, 9 months. Some people walk on 9 months. It's fast. Those are fast, precocious babies. So know the milestones that a baby should have. At 6 months, breast milk is no longer enough for your baby. It's no longer enough. Only breast milk. So you now need to introduce complementary feeds. You need to add the other things in the house. So let the baby start to eat what you eat at home. That's what I say. That's all my children. We don't like it in bottle. Uh-uh. We don't like it in bottle. So we want your baby to start to eat cup and spoon. Feeding bottles have problems with infections because it's difficult to wash, to maintain. And so just use a cup and spoon and get it done with. So cup and spoon will take care of all the things that we need to feed. So you start to feed your baby with this. And then we have what we call our complementary feed, our cereal. Your local cereal that we do here can be very rich. That's pap. When you take your cornmeal and you do your cornmeal, don't do and throw away the fiber in it. No, your cornmeal, you add palm oil, you add some protein, it could be groundnut, ground palm nut, add it to it, put sugar, maybe it's good to go. So you don't need to buy all this. Thankfully, I never spent money on those things. My children didn't like them, but even they liked them, so, but I knew better. So they start to eat what you eat. So you eat your cereals, and then so you can make that local cereal, and it's richer. It's rich, it's very rich, much richer than I think, in my opinion, and more convenient, more cost effective than a lot of the commercially available baby. See, but by 6 months, your baby can start to eat mashed potatoes, mashed noodles with fish, and that. So let me now talk about the things that get a lot of mothers angry. Like, I think we discussed it earlier on this. It's my baby does not eat. My baby is not eating. No, my baby is not eating. What am I going to do? My baby is not eating. See, children. One of the things about life is the hunger to. The solution to hunger is food. There is no other thing that you will use to solve hunger than food. There's nothing else. Absolutely nothing else. But we need to understand how children eat. So you can have a picky eater as a child. Now, you don't want to make feeding time confrontational time with your child. If you make your child believe that every time it's time for food, it's a time for anger, it's a time for fighting, It's either you make that child to revolt and eat food, or you make that child to make food, rejecting food and being difficult with food, a way of seeking attention. So it's important that you know that children may not eat. You're not like you. So it's time for food. Okay. So you now sit down and then you, in 5 minutes, wow, the mountain has become plain, and then you go about your business. That might not be so for a child. So a child may take a longer period of time to eat. So make feeding time fun time. Let eating time be family time, and give that child opportunity to discover new taste. That a child says no to this meal at this time doesn't mean that he may say no next time. He just discovered it. So his initial reaction maybe no. But we play, we laugh. Take one more spoon. Okay, take 3 spoons for daddy. Take 4 spoons for mommy. Take 4 spoons for mommy. 1, 2, 3, 4. Will you take 2 more for daddy? Okay, okay. So you make it playful. And if hunger has really set in, that's how you eat. That's what I think. I'm not a pediatrician, but that's what I've seen. That's what I've experienced, and I think hunger has no other solution than food. So picky children, be careful, discover, make it mix things, mix different taste. If he doesn't like the taste of fish today, he may like it next month, but he may like meat. So he may like chicken. So just mix it up. Make sure they're taking enough nutrition, enough protein, enough food and sleep to maintain their growth, and they will be the better for it. We've spoken about sleep. I won't talk about sleep again today. You can go and watch the video we did about sleep. So the next thing I spoke about last week, I just like to mention it again, is about which hand is the dominant hand. I remember growing up, they beat a lot of folks for using the left hand, for being left-handed. The, the, the teacher will beat them. Stop using your left hand. God, using your left hand to. Don't use your left hand to write. There was really a problem. Then it's unfortunate that they didn't know. We have our brains have 2 hemispheres, right and left, and one part, the other one hemisphere controls the contralateral side. So your right hemisphere controls the left side of your body, and your left hemisphere controls the right side of your body. And each one of us, no, not each, most of us have one hemisphere as dominant. And for the vast majority of the people on the face of the earth, the left side of our brain is the dominant side of it. So that's why most people are right-handed. They use their go-to hand is a right hand. So they use it to write, they use it to do the common activities. But we have some people that is the right side of their brain that is dominant. And often those people are I don't know, well, those people often tend to, maybe they are because they are different, they tend to also be creative. And we have some very, very popular people in the world that they've been left-handed with their right. Barack Obama, like I mentioned, is a left-handed individual. It's unfortunate that a lot of children have been beaten, their confidence shattered, because while they were younger, it was seen that they were the left side of their body was the dominant hand that they were using. That's a shame. That's a shame. But we now know better. Yes, I understand that culturally speaking, your culture and our culture, the Yoruba culture, for instance, sees the left hand as a mark of respect, disrespect. So, for instance, if I wanted to give someone something to someone older, if I start giving the person with the left hand, the person is going to look at me, huh? Huh? Me? Me? And all that kind of stuff. So it's okay. You can now teach your child, allow your child to flourish and be dominant with his writing, with the things he's doing with his left hand. But likewise, now teach that child that culturally in our culture, we tend to give things with as a mark of respect. As soon as that child is old enough to understand that, don't confuse. As when that child is old enough to understand that this is part of the morals in our society. This is part of the norm. This is part of the culture. So you teach that child that, so that the child will now do that. But you must write with your right hand. You must, we don't want left-handed person. No. So let's build that child. Let's encourage those children to grow effectively. One of the things that will happen to your child as your child grows is that your child is going to have fever, right? Your child is going to have fever. So, especially those fever, the fevers tend to start at around 6 months. When the child starts to crawl and when it starts to grow new teeth. And so we have people that believe that teething is a disease. They even have a name for it in our environment. They call stooling. I don't want to speak vernacular, but they call it the stool of teething. Yeah, diarrhea as a result of teething. Ladies and gentlemen, brothers and sisters, teething is not a disease. There is no disease like teething, like your a child starts to have fever or anything because is removing tooth. Yeah, there can be difficult. There can be a difficult teething process sometimes, um, but that's really rare. That's really rare. So if you have an impacted tooth or something like that, but that's really rare. For most people, it's a flawless. Yeah, their gum may be itchy and all that, but there is no fever. Fever is a sign of ill health. Diarrhea is a sign of ill health. If your child is running stool, if your child is having running stool, is having fever, take your child for evaluation. Let your child see a physician. But teething is not a disease. So all these teething mixture, teething powder, teething this, please no. I don't know how many children have died while they were having malaria in this environment, that their mothers, their parents, their fathers, their teachers, their caregivers thought that it was because they were having teeth. So they gave them a mixture that had a little bit of paracetamol, suboptimal dose of an anti-malaria, and gave them a sleeping agent. So by the time that child presents at emergency, PCV 6%, PCV 8%, and that child died. Yeah, so I don't know how many have seen that way. Yeah, it was just teeth. It was just teeth. It was just promoting teeth. And I gave him this mixture, teething mixture, and he was still playing. And he will play. In the night, he will be out a little bit. He was still playing. It was still, and then I just this morning, he just started convulsing. And then I brought him, it was just yesterday, and the woman is helpless. The woman is wondering what happened. Have I killed my own child with my own hands? It's the ignorance. Teething is not a disease, right? So if a child is running fever, a child is running stool, and you don't know what it is, get that child to see his or her physician. So teaching is not a disease, right? So what are the other myths? So if you have questions, please go ahead and be asking your questions. We spent over 23 minutes already online. I hope we can round this up in like make this about 30 minutes. So if you have questions, right, please go ahead and be dropping those questions as we start to wrap up there. So, what other cultural myths are there, especially in this environment? They think that you should not give your children proteinous food. You say, what? That's true. You grow up in an environment that say, don't give your children meat, don't give your children fish, don't give your children like egg. If you give them, I don't know how who came up with that kind of stuff. That if you give them these things, they will steal. That's a terrible culture. No, I told you the good one that we have. I told you one good one that I've seen. That one is a terrible, terrible culture. Those are the things that make these children stunted. They don't grow to meet their full potential. Their brain development, their physical development becomes stunted, right? Even their mental development, their psychological development. When you see an adult tearing meat, tearing and eating, and then you are a child, you they give you one. One ah, this is the world. Now, so the world be. No, so we don't want to do that. We want to give our children. They are the ones that need it the most. You don't, as an adult, you don't need any of these things anymore. You don't need protein, any proteinous food anymore. You don't need it. If you eat it, if you don't eat it, no problem. You'll be okay. But your children need food high in proteinous content. So let's feed them well. Egg, meat, fish, beans, legumes, vegetables are also important. Milk, vitamin D, the things that they need to build and be the best that they should be, right? So let's take care of that. Now, also, no, we are talking today is the day of International Day to speak out against violence against women. We need to believe our children if they complain to us of misdeeds by adults, especially sexual misdeeds. If your child tells you that so and so uncle, so and so auntie did this to me, please take it serious. Don't say, no, 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 uncle will not do that. Don't shut that child down. Don't shut that child up. In fact, feed them early enough to tell you. In fact, my kids know when somebody says, don't tell daddy this, that's the more reason why you must tell me. When somebody says, don't tell mommy that, that's the more reason why you must tell us. No secrets. Tell us everything. Let us know. Huh? Because that, I'll believe you. I believe you. So your kids must know. Don't make them feel that their opinion is not important. It's not. It's not good. It's not good for the development of our children. Believe them and let them know that you believe them. Right? We put a lot of pressure on kids. I remember some years ago, my kid had an exam. She was then she was still in primary school. Now she's in senior high school. She was she we're going for exams. Okay, you need to do your exam. Ah, do well so that I'll be proud of you. And then she now thought. She sat down. She thought for a while. I said, Daddy, if I don't do well, will you be proud of me? Ah, I just parked the car. I just said, no matter what you do, I want you to do well. It's great for you to do well. It's good for you to do well. But I will always be proud of you. You don't need to do more. You don't need to do, there's nothing you do. You don't need to do anything for me to be proud and happy. No pressure. Because do you know what? Some kids were cheating in high school, in primary school, not high school, sorry, pardon, in primary school, cheating in primary school exam because they want to take prize so that they can make their daddy and their mommy proud of them. A lot of our kids are facing pressures. Let's remove this. No, don't translate the pressure to a primary school girl, primary three, uh, a grade three, grade two. No, let them be the best that they can be. But I'm not promoting mediocrity. My children try to tell you, do the best, be the best. But let's not repress and put uh, a, a heavy burden on our kids that they cannot bear. Right? I think we said a lot today. So, do we have any question? Meat, bedwetting. Okay, bedwetting. Somebody mentioned, my assistant, my colleague mentioned to me earlier that we should talk about bedwetting. So, bedwetting is natural. So, everybody, I don't care whether you are, whoever you are, you wet your bed as a child. But we expect as children grow older, that they outgrow it. So, if a child after 6 is still having a high frequency of bedwetting, so that child deserves um, to see a physician, right? That child deserves to be evaluated. And the earlier we take care of it, the earlier the better, because it can affect confidence. Yeah, it can affect the confidence of that child. And there are various mechanisms that can be used, various interventions that are possible to help that child overcome bedwetting, right? So that it doesn't, so we can find out whether there's something organically wrong. You can find out whether it's, and if you see a child that had attained continence before, and then suddenly that child suddenly starts to wet the bed, that means something has gone wrong. You need to see that child. And often it's a sign of abuse of one kind of bullying. And children can pretty, and it doesn't have to be sexual abuse. Children can be pretty vicious amongst themselves. They can be vicious amongst themselves. So find out how that child is feeling. Find out how that child. But bedwetting is a phenomenon that has solutions. Has solutions. Don't be afraid. And but even as we look for solutions, please, is of utmost importance that you you don't destroy the confidence of that child. Because bedwetting will stop. It's a matter of time. For in the vast majority of cases, even without concerted medical intervention, bedwetting will ultimately stop for most people. But so some people it doesn't stop. So that's why it's important for you to go and get medical intervention so that you can stop it for you with concerted interventions, some medicines, some lifestyle changes, some thoughts, or if something is organically wrong, intervention, surgical intervention, then we can take care of it. However, if you have destroyed the confidence of a child, by the time that bedwetting now stops, the confidence may not be built back. So in all we do, we try to build the confidence of the child. We try to make the don't beat children because I will kill you. No, 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 no. I will discipline you. Love, attention. It's not easy. I know it can be pretty tough as for parents to say, why is my child bedwetting? My child is 10. What am I going to do? My child is 12. My child is 14. My child is 16. Don't wait till then. Go for intervention. Don't wait as early as 6-year-old. Child is not continent. Go check. Something wrong? Can we do? Find out and take care of it. Okay? Right? Good. What is the cause of convulsion in children? Many, there be 1,001 things. But the commoner one that you and I can do. So if any child that convulses deserves to see a doctor. Right? Any child that convulses deserves to see a doctor. And the doctor, even if the convulsing stops and it never happens again, we need to get to the root of that episode and know what happened. But often, what causes convulsion commonly amongst children that is what we call a febrile convulsion. And that's why we're talking about fever. I think I mentioned it last week. I'm not mentioning it today. Fever, when the body temperature of a child gets very high and gets to a high, the body sometimes we want to try because fever affects the brain of children, affects the body wants to break that fever. It wants to do something to stop that fever. So what it does is to convulse, but that convulsion is also dangerous. It still damages the brain. The fever causes the brain to trip to convulsion, and that convulsion damages the brain. So we don't want convulsion. We don't want that to happen. So that's why we talk about tepid sponging, right? So if you have a child that is running fever and you don't have any analgesic at home, it's late in the middle of the night, you cannot go anywhere. What you can do to help that fever to come down, or even if you have applied analgesia and the fever is not going down, because if I've applied analgesia doesn't mean that the fever will go down immediately, and rather than before the time the analgesia is to work or the analgesia is not working as you wanted, what you want to do is tepid sponging. You don't use cold water. Mm-mm. Yeah, you use normal lukewarm water, tepid. So the water is not hot, it's not cold. Tepid, it's neither hot nor cold. So you don't want hot water, of course, you want to be able to lose it, and you don't use cold water. Cold water paradoxically causes the internal heat to increase because it causes the blood vessels in the skin to contract, so the body will store heat. So the outside may be, when you pour cold water on the skin may be cold, but the internal, the core body temperature is high, and the body still perceives, and the body cannot even now lose it. So what you want to use is tepid sponging. You take water, take a soap, a sponge, a piece of cloth, yeah, put it into the lukewarm water, squeeze it to have some moisture, and then you rub it on the skin of the child. You rub it on the skin of the child. As you do that, that same film of water will evaporate. But that as it evaporates, it takes heat with it. It's physics. So it takes energy for it to evaporate. So that energy will cause that body to drop, the body temperature to drop. So if you do tepesponging and you do it properly, that child will not convulse. That child, once it's febrile convulsion, but there are other things that can make a child convulse apart from febrile convulsion. So for those ones, you want to take your child to the hospital. So whatever the cause, whether it's febrile convulsion or anything, any child that convulses deserves to see a doctor. So what do you do when a child is convulsing, which is very important? Huh? Don't force spoon into the child's mouth. Huh? Don't say, hey, the teeth must not come together. Hey, the teeth must not go. The teeth is yeah. I've seen they brought a child to me in the hospital, they broken the front teeth, all kinds of crazy stuff. You don't want that. What you just want that child to do is not to harm himself or herself while convulsing. So you create room, move dangerous objects about, and turn the child to the recovery position. The left side, head turned to one side. Make sure that the tongue has not fallen back so that it doesn't. And if it vomits, so that if it vomits, any effluent can just flow to the side. But you don't want to force anything into the child's mouth. You don't want to urinate on the child. You don't want to force convulsion on the child. You don't want to put the child's feet into fire. Eh? You don't want to slap the child. You don't want to pour water on the child. You don't want to do any of those kind of crazy stuff, right? Just put on one side. I think we have a video on that on Living Health TV. We just made a video on that, on what to do when somebody is convulsing. So check it out. And I think I've spoken about it some time ago. So check it out. No, we don't want to do all that. And we take the child to the hospital so that they terminate the convulsion. The doctor will know what to do to stop the child from convulsing, and then give the child some medicines and control and treat the underlying cause of the convulsion, right? So that we don't have complications as a result of those convulsions, right? Okay, I think that's a good question. Is there any other question? Any other question on this topic before we close today? Next week, I'm looking forward to next week. Next week, we're going to celebrate the International Day of Violence Against Women. We're going to have a scenario, discuss a scenario, and see what are the things that make for intimate partner violence. Why do men beat their wives? And sometimes wives beat their husbands. Yeah, it happens. So men are the ones being bullied mentally, physically, in but it's more common, of course. Vast majority of cases, it's men that are bullying and being violent against their partners. Okay, so we're going to look at that. Look at signs you should look out for. What are the things that you can do, practical things that you can do to protect yourself and even your loved one from violence in the home, right? Okay, so is there any other question? Okay, in the absence of any other question, I want to say big thank you to everyone that has joined us today. Tomorrow, next week, Friday, 3 p.m., by the grace of God, we'll be back on Living Health TV Live. Thank you, everyone that has waited, and those that have joined in, that have watched. God bless you. Until we come again next time. Remember, I say, as area they say now, life, you know, get duplicate. God bless you.